Welcome to the Community Health Relations Program Volunteer Training. My name is Paula Woodford, and I'm the Director of Volunteer Engagement for the Greater Carolina Chapter. Also on the call today is Barbara Schutz, who's our Services Manager with the chapter. We'll be leading the training and sharing with you a lot of information that we hope that will be helpful to you as you begin your visit as a Community Health Relations volunteer. Please know that much of this information will be available to you in Toolkit. So please know that you do not need to try to memorize all of it. We just want to be able to give you enough resources that so that you are familiar with the chapter. So we're going to begin today with Barbara going over our agenda.
Thanks, Paula. Today we're going to give you a brief overview of the program, review the program goals and expected outcomes of visits to healthcare providers, and give an overview of MS and the National MS Society resources. Then we'll talk about the details around the visit, including how to identify healthcare providers, scheduling the visit, what to take with you, and documentation after the visit. Volunteer liaisons will engage healthcare professionals by visiting the providers, including primary care physicians, neurologists, physical therapists, occupational therapists, and more. Healthcare providers and their staff are important referral services for the people with MS and their families to the National MS Society. The National MS Society will be able to extend its reach to outlying areas by having trained volunteers develop positive relationships with community health providers. By serving as a representative to local health care providers, volunteers are responding to two of the National MS Society's strategic response goals. This program allows the Society to mobilize the millions of people who want to do something about MS. It also allows us to develop, deliver, and leverage resources to enhance care for the people with MS. Now to go over some of the goals. If the professionals are aware of programs and services available to people with MS and their families, they'll be more likely to refer them to the National MS Society. When a community health relations volunteer makes a visit, they'll be able to get feedback about the needs of the patients seen by healthcare professionals, which will then in turn improve our services. We also want to let professionals know about what resources we have available for them, which will allow them to better serve their patients with MS. Although we wish we could have an office in every part of North and South Carolina, we can use this program to extend the reach of the National MS Society to outlying and rural areas. With assistance from community health relations volunteers, we can make a bigger and broader impact. Paula now is going to give you a brief orientation about volunteering with the National MS Society.
As a volunteer with a society, we always want to make sure you have enough information so that you can answer questions that people might have. So we're going to do a little overview right now about MS, some of the symptoms and treatments, and then we're going to share more information with you about programs and services, advocacy, and other parts of the chapter. So first we want to talk a little bit about what MS is. Multiple sclerosis is a chronic and often disabling disease that involves an immune system attack against the central nervous system, which is made up of the brain, the spinal cord, and the optic nerve. The disease is thought to be triggered in people who are genetically susceptible to it by a combination of one or more environmental factors. Women are 2 to 3 times more likely to be diagnosed with the disease than are men. And while most people are diagnosed between the ages of 20 and 50, MS can appear in young children and teens as well as much older adults. In multiple sclerosis, damage to the myelin and the central nervous system and to the nerve fibers themselves interferes with the transmission of the nerve signals between the brain and the spinal cord and other parts of the body. This disruption of the nerve signals produces the primary symptoms of MS, which vary depending on where the damage has occurred. And this slide gives you some of the possible symptoms. Symptoms may be mild, such as numbness in the limbs, or severe, such as paralysis or loss of vision. The progress, severity, and specific symptoms of MS are unpredictable and vary from one person to another. Although there is still no cure for MS, there are effective strategies that are available to modify the disease course, to treat exacerbations, and manage symptoms. On the slide, we've listed some of the disease-modifying drugs: Avonex, Betaseron, Copaxone, Extavia, Novitrone, Revit, and Tysabri, and 3 of the new oral medications, Aubagio, Gilenya, and Tecfidera. There are also symptom management medications available, such as Ampera, which helps to improve walking, and Baxen, which helps with spasticity. As you are representing the society, it's really helpful for you to know how the organization actually got started. And it's really an amazing story of a volunteer just like you who decided to do something about MS. Sylvia Lowry's brother, Bernard, was diagnosed with MS in 1946. At that time, there were really no treatments for the disease. And she decided that that was not something that she wanted to stand for. She wanted to do something about MS. So she put an ad in the New York Times asking for people who had successful treatment to contact her. Well, no one was able to give her a successful treatment, but many, many people contacted her. And from that ad in the New York Times and that response, the National Multiple Sclerosis Society was born. And in 1947, the Society sponsored its first 3 research projects. And today, the Society is a driving force of MS research and global research efforts. The vision and the mission of the MS Society are on this slide. And of course, the vision is creating a world free of MS. And through our 50-state network of chapters, the Society helps people affected by MS by funding cutting-edge research, driving change through advocacy, facilitating professional education, and providing programs and services that help people with MS and their families move their lives forward. During your visit to healthcare professionals, it's important for you to be familiar with the variety of programs and services that we offer. Some of them are listed on the next several slides. On this slide are some of the nationwide programs and services offered by the National MS Society. The National MS Society's website is a wealth of information and resources, and you see it listed here on the slide. From that website, you can also search for your local chapter and become connected to the Greater Carolinas chapter website. The MS Connection is a newsletter of the Greater Carolinas chapter, and it's sent quarterly to chapter clients, the medical and social services community, and other interested individuals. The Connection contains information about chapter activities, local resources, and current information about MS. The Momentum is an award-winning quarterly magazine from our national office, which provides information on the disease, human interest stories, research updates, and more. And people with MS are eligible to get a free copy. The Young Persons with MS Network is a network for families with a child or teen with MS. And the network provides these people with connections with other families by offering multiple program options. We will talk a little bit more about the Research Now campaign in an upcoming slide. The MS Learn Online is the Society's online educational webcast, which includes a variety of topics. An MS Connection online community is an online community that allows you to find, store, and share meaningful updates, posts, videos, articles, and other content about MS and topics that you care about most. And you can connect with people, groups, and discussions that relate to the topics that are important to you. Today, the National MS Society is a driving force of MS research, and it's actually the largest private sponsor of MS research in the world. Since the founding of the National MS Society in 1946, the Society has expended over $771 million to advance MS research. And in 2012 alone, the Society invested $43.3 million to support more than 350 research projects around the world. Now, we are involved in a campaign to raise $250 million for MS research by the end of 2015, with our goal to stop all disease activity and prevent further progression, restore all functions that have been lost, and end and completely eradicate MS. In addition to the NOW campaign, the MS Society has created an entity called Fast Forward, which works to speed treatment to people with MS. And it focuses on expediting the development of treatments and a cure. It's a business approach to speeding that development for people seeking a cure for MS. This slide gives you a little bit more information about the actual Greater Carolinas chapter. We serve over 14,000 people affected by MS in 82 counties in North Carolina and all of South Carolina. Our chapter has staff members working in areas of programs, development, public policy, PR, and marketing, and administration. And we provide educational programs and direct services, including financial assistance, to over 14,000 people living in our chapter area. Now, Barbara's going to share more information with you about our programs and services.
And I just want to remind you again, this is going to be a lot of information, but we really want you to use this more as a tool in reference to when you go on visits. It's not something you have to remember every detail about. We're proud to provide the most current and accurate information about MS to people living with MS, their families, professionals, and the community. MS, a guide for newly diagnosed, is a resource for everything a person needs to know about MS. It includes a section on the nature of MS, the most current medical treatments for the management of MS, life planning, children with MS, and more. Individuals who are newly diagnosed can receive follow-up calls at 1 month and 6 months after registering with the National MS Society. So staff members will answer any questions they might have, explain National MS Society resources, and provide emotional support. Knowledge is Power is a 6-week program for people who are newly diagnosed. Articles and DVDs are mailed each week on a specific topic. And the next step is a DVD and pamphlet designed to answer questions that are commonly asked immediately following a diagnosis. We also offer a wide variety of programs for people with MS, their families, and healthcare professionals. These programs range from in-person meetings to teleconferences and focus on a variety of topics. We have books, videos, DVDs, cassettes, and CDs on topics of interest to people with MS. Through the lending library, they're used for short-term loans, and the chapter provides a self-addressed stamped envelope to return the items. The program is free. The National MS Society provides a wealth of information on different topics, individual symptom management brochures, research, coping. If someone has a question about it, chances are the Society has a book for it. The chapter's Information Resource Center provides literature and helps people locate resources in their communities. Here, counselors and staff members distribute up-to-date information on topics related to multiple sclerosis, such as research, treatment, and symptom management. They can also provide referrals to health professionals, social service agencies, and other community resources. To access this service, call the number listed on the slide, 1-800-344-4867. We also have programs around physical health. Partners in MS Care recognizes and supports quality MS care. The program involves healthcare professionals in areas of neurology, mental health, and rehabilitation. Healthcare professionals recognized as partners in MS care demonstrate knowledge and experience in MS care. They have a special interest in treating people living with MS and work closely with the National MS Society. Centers for Comprehensive Care are led by clinicians with demonstrated knowledge and experience in treating MS and offer and coordinate a full array of medical, mental health, and rehab services. They have a strong collaborative relationship with the National MS Society. We currently have 2 centers for comprehensive care in our chapter area. Raleigh Neurology Associates located in Raleigh, North Carolina, and Carolinas Medical Center in Charlotte, North Carolina. The chapter offers PT and OT screening program. The PT screening will allow the therapist to recommend appropriate interventions for wellness and mobility issues. And OT screening allows the OT to make appropriate recommendations for fine motor coordination, energy conservation, and more. Wellness programs are available throughout the year that can help living with MS deal with physical, emotional, spiritual, and social well-being factors that can be impacted by the disease. We also offer a newly diagnosed wellness program scholarship, which is for people who have been diagnosed for 2 years or less. It's $100 to help them pay for a health club membership, personal trainer, or exercise class. The Greater Carolinas offers programs and services to provide emotional support for people living with MS and their families. There are several social workers on staff who are available to provide MS education and serve as a resource for information, referral, and counseling and support. We also offer a variety of programs and teleconferences throughout the year that are focused on counseling and support. Self-help groups provide a chance for individuals with MS, their families, and friends, and other care partners to share common experiences and concerns, provide and receive emotional support, obtain information related to the disease, and on various aspects of living and coping with MS. Groups are led by people with MS or care partners, and all groups are free of charge. The Greater Carolina chapter has over 45 self-help groups throughout the chapter area. MS Friends is a program that connects a person with a volunteer living with MS. The common bond of living with MS creates a unique connection. MS Friends volunteers complete a rigorous screening and training program and are focused on the needs of those who call for support. It's a free program to available from 7 a.m. to midnight, and to access it, call 1-866 MS Friends. The telephone support groups are led by mental health professionals. These groups are open to people with MS who may be unable to travel to regular self-help groups because of more severe disabilities or lack of transportation. Connections with friends, family, and others affected by MS is vital to keep a person with MS moving. We offer a variety of different programs geared towards family and social support. Caring for someone with a chronic illness, such as multiple sclerosis, can be deeply satisfying, but it can also be physically and emotionally exhausting, and we provide support for families and care partners through our various caregiving programs. MS can take its toll on family, leaving little time or money to do fun, family-oriented things together. Our MS Adventure program throughout the year offers the opportunity for families living with MS to join with others in similar situations and enjoy social outings such as hockey games, baseball games, or a trip to the aquarium. During programs for families, children, and the parents are offered the opportunity to meet other families and share life experiences. MS Adventures at Camp Chestnut Ridge is a weekend retreat for children ages 10 to 14 who have a parent or guardian living with MS. It's held on an annual basis in August and is offered to families free of charge. We also offer other family programs throughout the year. Couples Retreat is designed to help the person living with MS and his partner strengthen their relationship and minimize the impact the MS may have on their lives. Kids Fund is a program that offers financial assistance to children who have a parent or guardian living with MS. The funds can be used to join sports teams, purchase uniforms, attend field trips, purchase school supplies, and more. And Keep Smiling is a quarterly newsletter for young children who have a parent with MS. There are interactive games, a story, and a discussion sheet for parents. Children ages 5 to 12 who may want to receive this newsletter can have their parent contact the chapter to get on the mail list for it. Whether a person just received a diagnosis with MS or has been living with it for a long time, we have provide programs about how to maintain quality of life for years ahead. We offer in-person programs and teleconferences that are focused on accessibility and how to maintain and improve independence. And all of our meetings and events are held in accessible locations. We also maintain a chapter loan closet managed by Jarble Medical Equipment Company for people who may want to borrow physical equipment short term or may not have the funds or insurance to purchase it on their own. The chapter offers financial assistance to people with MS to meet financial guidelines based on a sliding scale. This support can assist with crisis situations such as food, utilities, or rent, and purchase of medical equipment. We also provide money to assist with home and vehicle modifications. People living with MS often continue working long after their diagnosis. Disease-modifying drugs, new technologies, better sensor management, legal employment protections, and community resources can help you remain in the workforce. We offer a variety of programs, education, teleconferences on employment issues. We also have an employment advisor. In this program, we provide assistance with in-depth employment-related issues concerning job discrimination and reasonable accommodations. It does not provide legal advice or a job, but rather connection to employment resources. And Career Crossroads Employment and MS is a self-study course designed by employment and MS experts to help individuals living with MS remain in the workforce. This course includes 6 video modules that highlight options and strategies to achieve that goal. And these are some examples of the work that Greater Carolina is doing in regards to long-term care. We provide in-services at long-term care facilities and other community agencies. And the Home and Community-Based Care Committee uses innovative ways to address quality of life issues to provide options for long-term care for people living with MS. A respite care program is a program designed to improve quality of life for people living with MS and their caregivers. The primary goal of our respite care program is to allow the caregiver a break from daily responsibilities. It provides a short-term, non-medicated home health care services for individuals with MS who require care and/or supervision. And also living with MS can be overwhelming. Some people who have MS are unable to identify available community resources that can help them cope with the challenges of a chronic disease. In our care management program, the social worker is sent into a client's home to assess, plan, and coordinate needs relating to long-term care issues, access to entitlements, and financial management. Appropriate referrals to community services and resources are also given. This program can provide the hands-on assistance that many need to improve the quality of their life and remain independent. Now, this next slide is focused on the professional. really important to be familiar with these when going to visit healthcare professionals. We provide many resources for them. The MS Clinical Care Network is an essential resource for the healthcare providers and their patients. It provides easy access to comprehensive information about MS management in a variety of formats and dynamic, engaging tools and resources for clinicians, and consultations and literature search services to support high-quality clinical care. To access the Clinical Care Network, they can go to the website listed, or if they want to reach a MS specialist colleague that works in the same field as them but has a more specialized in MS care, they can email this healthgrowth_info@nmss.org to get feedback from them. The MS Clinical Care Connections is this site's quarterly e-newsletter for healthcare professionals. It delivers information and resources on a variety of clinical topics. In addition to the services of our MS Clinical Care Network, we offer continuing education, teleconferences, self-studies, and webinars. We have resources for pediatric MS available through the network, as well as fellowship applications for neurologists, nurses, and physician assistants. The MS Diagnosis and Management app is a unique free tool and resource that provides important information about the diagnosis and management of multiple sclerosis for practicing clinicians. This app is a concise compilation of current, easy-to-reference, evidence-based information that they can access at no charge as a smartphone app. The Society publications that are specifically for healthcare professionals address complex treatment issues throughout the care continuum and facilitate clinician-patient communication to enhance understanding and adherence. And slide decks and notes are available for training of physicians, nurses, rehab professionals, mental health professionals, and dentists, and providing an MS overview to lay audience. They're available for healthcare professionals to use for training other people.
Now I'm going to talk a little bit about our advocacy and fundraising department. The focus of our advocacy is to empower people living with MS to advocate on the local, state, and federal level. Advocacy is supported at the regional level through our Senior Director of Advocacy of the Southeast region, as well as local chapter staff. We have volunteers who serve on the North Carolina Chapter Advocacy Network and help set the direction of our advocacy role in North Carolina, as well as our volunteers in South Carolina who serve on the Government Relations Committee, where they connect and engage new activists and work to address issues that are important to people living with MS. We also have volunteers who are veterans who serve on our Veterans Action Leadership Team, and they work to raise awareness about MS and the National MS Society within the veteran community. Of course, to provide the funding for the programs and services and the advocacy and research, we have fundraising events. And on this slide, there's a listing of all of the various fundraising events that our chapter has. As a community health relations volunteer, it's important for you to know about local events. And it's always a good idea to check with your chapter liaison to see if there are posters or brochures available that you can take with you to an office of a healthcare professional. People are often just waiting for an invitation to form our team or do something as an office to show their support for patients and our cause. As you see on this list, there are several major events. 2 bike events are held in the fall each year. One is the historic New Bern Ride in North Carolina, and Bike MS Breakaway to the Beach is held in both North and South Carolina, also in the fall. We have 13 walk events that are held in the spring in various communities across the chapter. The specific dates for these events will be on our website, and so we suggest that you check the website to determine when those are scheduled. We also have a Great Gatsby Gala that's held in Charlotte in August, and the Challenge Walk, which is held in Charleston in the spring, is a 3-day 50-mile walk. In addition to these, we have a women's leadership event, Women Against MS, that's held in the Raleigh area in the spring. In addition to these events, do-it-yourself fundraising is an opportunity for people in our chapter area to raise awareness, critical funds for the MS movement in new and creative ways. The do-it-yourself fundraising site includes helpful resources to help kick off an event and learn from others who are hosting their own. Examples of do-it-yourself fundraising include golf tournaments, dinner parties, bake sales, endurance events, and really any kind of event that might be interesting to you and your friends. Now we're going to talk a little bit more about serving as a representative for the society. When you're asked as a representative for the society, we ask that you consider and ensure safeguarding information of people with MS, including just even the basic information that they have MS. We're going to talk a little bit more about the chapter confidentiality policy later in the training. We would just want to make sure that you are aware that this is a very important piece of your role as a representative. In addition, we ask that you use accurate and considerate language while you are representing the society in your business with healthcare providers. What we mean by that is we ask you to avoid language that's more negative than it needs to be, or that makes MS the main aspect of someone. For example, instead of saying someone is an MSer or an MS person, we ask you to consider saying instead a person with it. Or instead of saying wheelchair bound, use the term uses a wheelchair. Or instead of handicap, say disability. In addition, we ask you, during your visits, to be an objective listener. It's easy to share stories about your MS or your family members' MS, but try to keep those to a minimum. Be sure that you focus your meeting with the healthcare professionals on educating them about MS and the society. In addition, if you get requests for advice or questions about medications and symptoms, please refer those back to the society. They can email the healthproc_info@nmsf.org website email address we've given you for clinical advice, or they can call the Information Referral Center at 1-800-344-4867. In addition, when you're acting as a representative of society, it's always appropriate for you to give an example of how you've worked with society or what something has meant to you. But again, use discretion in sharing your own personal experiences. And don't wing it when you're asked a question and you're not completely sure of the answer. Always direct the questioner back to the National MS Society. And again, you see the phone number there and the website, which again is a wealth of information for people, as well as the healthcare email address that's available for healthcare professionals. I want to remind you of one other thing. There are often times when people volunteer for pharmaceutical companies as ambassadors, and that's certainly a very appropriate role for people. So when you're serving as a representative of the society, you need to not be representing that pharmaceutical company. So you need to make sure that you're only representing the society when you're making the healthcare professional visit. Remember that your visit really should not contain any advice on medication or symptoms, and we should refer people back to a particular physician. If they need a referral to a healthcare provider, they can call the Information Referral Resource Center at the number we've given you. In addition, we are unable to send information to any person who did not personally request the materials. If someone asks you to send another person information, tell them that they can ask the person to call the Information Referral Center themselves for that information, or we can provide it to the person who asked and they can pass it along to another individual. And also remember, while speaking with a professional, do not use any partisan political statements or talk about controversial issues, and please do not make any inappropriate jokes. Now, Barbara's going to give you some more information about actually making the visits with healthcare professionals.
First, we're going to talk about what to do before the visit. We are in the process of training a volunteer chapter liaison, but in the meantime, I'll be your contact. And my contact information will be on the last slide. Volunteers will make 4 to 2 visits per year. You can select the healthcare professional you'd like to take information to, or we can suggest someone. We're placing an emphasis this year on educating professionals living in rural areas. If you have a professional you already have an established relationship with, that's an ideal place to start, or we can recommend someone in your area. Some community health relation volunteers visit more than one professional, or choose only one and visit several times during the year. We may also have requests from professionals that we'll ask you to go to. This is a program you can do as much as you like to spread the word about the National MS Society. It is important and a requirement that you email the chapter liaison the details of the professional you'll be visiting so we can make sure no other volunteers or staff have selected the same professional. Always get approval from the chapter liaison before making a visit. I'd like to suggest you call, make an appointment with the healthcare professional. Remember, their staff are also important relationships to develop as well. But keep in mind that in order to be most effective, we hope to connect with the professional providing healthcare. This program is designed to meet one-on-one with the healthcare professional so that they can get to know us. Please review your toolkit before each visit to make sure you have all the materials needed. Your toolkit will have a list of detailed information outlining exactly which material to take on each visit. And now we're going to review the items in the toolkit. It's important to be familiar with each item you're bringing to a healthcare professional. It includes, the list includes which material should be taken on each visit depending on what type of healthcare professional you're visiting. You'll need to work with the chapter liaison to ensure you have the most appropriate materials. And the healthcare professional can also look at their publications and resources for healthcare professionals and resources for patients for additional listing materials that are available to them. This first thing is a Dear Healthcare Professional letter. The letter that we designed for you to leave with the professional, reminding them of some of the most important resources. It will be available on our website, and you can adjust it as needed. And on the next couple of slides, the next slide is a brochure called Just the Facts. This includes just general information about MS. Living with MS is a brochure for newly diagnosed people. The MS Navigator describes the MS Navigator program and how to connect and register with the National MS Society. Connecting with others living with MS outlines our connection programs, including MS Friends, online peer connections, and self-help groups. And the chapter brochure provides information about and contact numbers for the local chapter. This is our program listing for patients. It's a listing of programs for people living with MS, and again, we can make copies of this if they'd like to provide this to their clients. This is a list of all of our brochures and pamphlets and can be used by the person living with MS to order literature. They can also keep it and call 1-800-344-4867 to order any. Most of these are also available online to you, and we can provide extra copies if they'd like to provide it to their clients living with MS. These are two forms that the provider should keep themselves. Publications and resources for healthcare professionals is a list of literature and resources specifically for the healthcare professional. They are available at the MS Clinical Care Network under Resources and Tools or by emailing the HealthPro email address. The resources for patients includes resources available for their patients living with MS, and it's a good reference guide for the clinician to keep and refer to when working with patients who have MS. The Health Professional Service Provider Intake Form is something that if they provide service to people living with MS and are interested in being listed in our database as a service provider, they can fill out this form and email, fax, or mail it back to the chapter. Within this form, they can provide information for 3 healthcare providers per office. The information provided after being reviewed and approved will be added to our database for information and referral purposes. This next brochure is really, really important. It's the MS Clinical Care Network brochure, and it provides them with more information on the network and then how to access it. This is the MS Clinical Care Connection sign-up sheet. It gives an example of the professional letters in MS Clinical Care Connection, and they can sign up for it using this sheet and send it back to the chapter. The personal information, including their email, will not be provided unless it was given on the Healthcare Professional Service Provider intake form. We have additional materials available depending on the healthcare professional you're visiting. This isn't an all-inclusive list. If you would like to visit a different type of professional, check with me. We may have some specific brochures available. Now we're going to talk about during the visit. Two of the most important pieces of information for you to remember to share on each visit are email addresses for our MS Clinical Care Network and the phone number for our Information Referral Center. These two resources are the key pieces of information every healthcare professional should have at their fingertips. Each time you make a visit or send a follow-up note, please remember to give this contact information again and again. Our MS Clinical Care Network is staffed by professional MS specialists who can respond to any questions submitted by their peers. The network offers a range of free publications and services designed to support and facilitate the clinical work of healthcare professionals. The Information Resource Center is staffed by highly trained MS navigators equipped to respond to the needs of the people with MS, their family members, friends, caregivers, and employers who call with specific questions about MS. Reference the talking point. points hand out for guidelines to follow during the visit. Remember to tailor the talking points to each specific healthcare professional. Introduce yourself as a volunteer of the National MS Society. Give an overview of the society. Give us a description of our programs and services for people living with MS and for the healthcare professional. Distribute any brochures or information and ask if this professional has any questions. Be respectful of the healthcare professional's time. Be on time for the visit, and be concisely talking about the programs and services available. You'll likely only get 5 to 10 minutes to meet with the professional. Also, let the healthcare professional know that we can put together kits for their patients who live with MS. In the kit, we would include information about the National MS Society, the Rare Challenge chapter, and then the professional could look at the publications listing and ask to include brochures that they find relevant. For example, urologists may want to include the brochure urinary dysfunction in MS. Confidentiality is extremely important here at the chapter, and we expect all our volunteers to abide by our confidentiality as well. Information about people living with MS will remain confidential. No information concerning persons affected by multiple sclerosis will be discussed outside the chapter office or with unauthorized parties. The National MS Society's mission is to provide services to individuals with MS and their families. Respecting their right to privacy is essential to this mission. These policies are in accordance with the Federal Privacy Act, and all representatives of the National Multiple Sclerosis Society are bound to them. The right to privacy is paramount. However, should it be determined that the individual is in imminent danger from others, the need to assure the safety of the individual must take precedence over the right to privacy. Now we're going to talk about after the visit. After each visit, fill out the healthcare professional visit follow-up form and return it to your chapter liaison. Remember to follow up on any items that may have requested for brochures or patient kits. And please consider sending a follow-up letter after you complete your visit. Thank the person you spoke with for their time and include contact information. Follow up with your chapter liaison about any additional materials we may need to refill your toolkit. And many of the materials will be available on the Health Relations Google Drive if you'd like to print them yourself. You can also turn your follow-up visit form there by saving it to the drive and adding your name to the title. Or you can save it to your computer and email it to the chapter liaison. As you can see on this last slide is my contact information. For now, I'll be your chapter liaison, and once we have our volunteer liaison training for this, we'll give you their contact information. We've covered a great deal of information today. Please just know that we're here for you as your liaison to the program, and feel free to email any questions at any time or call. Many of our documents can easily be emailed if you need additional copies. I have extra supplies in some of the books and brochures at your toolkits if you need additional copies. The final thing I need to ask you is please return the signed code of conduct, confidentiality agreement, and volunteer agreement that you will see in your toolkit. Thank you again for your participation today, and we look forward with your help to end MS now and experience a world free of MS. Thank you.